Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Now celebrating 17 years of broadcasting success, here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again. We've reminded you guys repeatedly on this program that open enrollment is going on right now. The deadline is fast approaching for you to be able to decide if you're going to keep your current plan or get a new one. This is something that's very important, but it can also be challenging for individuals as well, especially if they're trying to weigh the cost. We're excited to be joined today by Dr. Stephen Cha. He's going to share with you guys some tips and information on dual special needs plans for qualifying Medicare recipients with financial needs. And so I'm really excited about this segment for you guys. Dr. Cha, thank you so much for the time. I really appreciate it.
Thanks for having me.
Hey, glad to do it. I should mention that you're also the Chief Medical Officer for United Healthcare Community and State, and that's why I'm really excited about this information. So one of the big things here, I mean, as I mentioned, we've been sharing with our audience, Dr. Cha, about this open enrollment period, that now is the time for them to be able to make those decisions. Is there anything consumers should consider while they're making their decisions for their plans this year?
Yeah, so we know navigating health plans can be really confusing. So it's important for people to understand their choices. So the United Healthcare Dual Complete Plan is a type of dual special needs health plan, as you said in the intro, and it's designed for low-income people who qualify for both Medicare as well as Medicaid. And these plans can include extra benefits such as a care coordinator to help manage complex health concerns, things like dental, hearing, and vision. And this year we just learned a ton. During the pandemic, United Healthcare realized that we had to meet the needs of our socially isolated members. So we started to deliver food boxes and health items. And so this year we've added to our plan credits to buy healthy food and support to purchase approved health items.
That is great, and I know that's been definitely of help for your customers. Now, I think one of the things that you mentioned, of course, about finances, and that is one of the things that, even as I mentioned in the intro, Dr. Cha, is always an issue. So I guess an obvious question would be, what is the average cost for the United Healthcare Dual Complete Plan that you mentioned?
Yeah, people eligible for these dual plans can usually enroll for no monthly premium, and for most people, also no copays.
Oh, wow. And what I love about the website, and it's getdual.com, we're going to be placing that in the notes for this, joining us online for our friends at iHeartRadio, is that they can really specialize this. They can put in their zip code or their state to get the information there. What is your hope that people do, Dr. Cha, even for those who may feel like, you know what, I already have a health plan? Why would you encourage them to go ahead and take a look to see if maybe they qualify for the dual plan?
So these plans are really designed for low-income people on Medicare who need that extra help, maybe because of disabilities or health conditions or age. So that means people have Medicare and also find that money is tight or are already on Medicaid. And for those special populations, we're really trying to get the message out that we have help and we want to support those folks with the needs that they may have to manage those complex health needs.
Right, and I think, everyone definitely needs that coverage, so if they qualify, definitely making sure that they get it. Again, everyone, Dr. Stephen Cha has been our guest. He is the Chief Medical Officer for United Healthcare Community and State. Make sure you guys visit the website that I mentioned here. It's getdual.com. It's getdual.com. And again, we'll be placing that in the show notes for those joining us online. Dr. Cha, thank you so much today for the time. I really appreciate it.
Thanks for having me.
Hey, glad to do it. And we thank you, our audience, for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying, as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live today. Let's make today amazing. Take care.